very minor scratch there, although it does look like it has scabbed over, so that's okay. As long as there are no like open wound areas, that would be the main concern. Okay, so also noting overall skin complexion is even. We're about 2.5 inches from the inner elbow, and we're about 1 inch wide. So I'm just going to document here a slight reaction to the adhesive from the tape. Hello, Samantha. Hi, how are you feeling today?
How are you?
I'm doing well. Thank you so much for coming in. Obviously, we have you in as a volunteer today, so I appreciate your time. I have everything set up to get you prepped for our clinical trial today. So, as you know, you volunteered to be a part of our medical training for the new vaccine that is coming out. At this point, we are in the very, very beginning stages. We're still testing to see if patients are going to have an allergic reaction, any skin irritation, that kind of thing. So this is a very diluted sample that we'll be testing of the vaccine itself. And obviously it's not going to be injected. It's just going to be a topical solution. As part of the trial, just to make sure that we are testing everything very efficiently, I have several other allergens that we will be applying to the skin. That way we can see if you are just a person who has any allergies to start with, or if you will be a good candidate to move on to phase 2 of trial testing. Okay. All right, so I do have just a few questions to get started with. Just a couple things that are standard here. So let me just, okay, so we have you in, and this is trial D1. Now, we don't have on file that you have any known medical allergies, so no allergies to medication or anything like that?
Not that I'm aware of.
Okay. So no known medical allergies. Obviously, that would be a disqualifier, so as far as you know, that's very good. Any issues to any kinds of foods? Shellfish is very common, nuts?
No.
You've never had any sort of reaction?
Eater, but
okay, just more so a preference thing?
Yeah.
Okay. All right. And aside from food allergies, any intolerances, like gluten intolerance, lactose? Okay. So you said you're a picky eater. Do you follow any specific diet, veganism, vegetarian?
No, nothing like that.
Okay, so just standard. All right. And any environmental allergies? So seasonal allergies, dogs, cats?
Maybe a little bit of seasonal allergies, but just or like dust when it flies up my nose a lot.
Got it. So possible dust irritation. Okay. Seasonal allergies, would you say that you ever have to take anything for them? Are they like particularly severe? Not really?
No, not
okay.
Just the sniffles, I think.
Okay. And is that, do you find that you have that year round, or is it truly like spring kind of thing?
Like a spring thing, yeah.
Spring, okay. So obviously fairly common. So I am going to test you for dust mites and standard like pollen, trees that are local to the area, that kind of thing. So that will give us a little bit more information there. And a couple follow-up questions about the testing itself. So you've not participated in any clinical trials, either related or unrelated? Okay. So there is a time period just for legal reasons. If you've participated in a medical trial, you do have to wait 6 months before starting a new program. So just have to verify that. And it looks like we already have your emergency contact on file. Did you want to change any of that information? Still appropriate?
Okay.
Alright. Looks like for any follow-up information, I have a phone number and an email. Are all those still the same?
Mm-hmm.
Okay. Perfect. Alright, so let me just put that we are doing 24 standard panels. So I have 24 individual samples that we will be testing today. We are doing the grid panel. Non-injection topical. So we do have 2 different trials going on. One where patients come in and they get actually injected, and then one where we just do the topical solution. So just being sure to document accordingly. All right, so it looks like that is everything. Do I have your consent to go ahead and proceed?
You do.
Okay, perfect. So if at any point, obviously, you have any concerns or you are feeling uncomfortable, obviously, once we apply the allergens, if you start to feel particularly itchy or anaphylactic, like your throat is swelling, if you feel any tingling of the mouth or nasal passages, be sure to let me know so that we can clean the area, obviously, and try to figure out which of those allergens are causing that reaction. All right, so I am going to begin by just placing a cloth down on the table just so we can minimize any chance of cross-contamination here. All right, okay, so go ahead and place your hands on the table for me, Samantha. So what we're going to do to start is just a visual inspection of the area. So I'm gonna have a look at your arms, a look at your hands. If there's any open areas or scratches, anything that could have a risk of infection, then we would have to postpone. So I'm just gonna have a look here. So, all right, so as we get started, is there any previous injuries to the arms or hands, elbows, wrists, joint area?
No.
No. Okay, and no physical pain at this time?
No.
Okay. So I'm just going to have a look. I will likely be using your right hand as it is closer in proximity to me, but I do like to just have a look and see if there is a side that would be preferable. Very, very minor scratch there, although it does look like it has scabbed over, so that's okay. As long as there are no like open wound areas, that would be the main concern. Okay, so also noting overall skin complexion is even. No signs of discoloration that I would need to note ahead of time. Hand texture is smooth. Good. Very prominent veins. So just noting a little bit of distension here on the right side. So at this point, I'd just like to rule out any signs of swelling or inflammation. So that way, if you have an area that's already raised above the surface of the skin, once we apply the allergens, I can document that that was an unrelated cause there. So I'm going to have you flip your hands over for me. Same thing, looking at the back of the hand. Obviously, we won't be using this side for our sample, but just making sure there are no ailments here. Okay, skin appears clean and dry to the touch. I'm going to do a bit of a palpatory assessment. Now what that means is I'm just going to use my hands to feel around for any abnormal nodules or anything that could be lying underneath the surface of the skin. So you are just a little bit cold to the touch. So I'm just going to feel around at the joint area to start with, feeling at the inner elbow. I realize this seems rather extensive for an allergy test, but because this is a clinical trial, we just have to be very thorough. Just not feeling any signs of distension there. So I'm going to run my fingers here between the two bones of the forearm. So I feel spacing here. Again, no signs of abnormal tension there. Okay. So I'm just going to feel at the wrist. This is oftentimes where we tend to find joint dislocation or just overall distension. Just feeling along the fingers, between the joints. So just looking for any signs of rigidity here, anything that could indicate an excess of scar tissue or lack of mobility of the digits, which so far is not notable. Very good. So I'm just going to flip your hand back over here. Normal distension here at the wrist. Good. Alright, so I'm just going to have a look at your circulation. So we have what is called capillary refill at the tips of our fingers, which essentially is just blood refill of the very tips of your fingers. So if I occlude here, it kind of creates a white occluded look, which is just the lack of blood flow to the area, and upon release it returns within a normal amount of time. So no signs of poor circulation. So fingers are warm to the touch, just slightly cold up towards the shoulder, but that's okay. All right. Okay. So another thing I'm going to do is check for abnormal discoloration here. So I'm going to have you hold your hand up to your face. So just looking for an overall standard color here of the hand compared to the cheek and the neck area, which is even there. And if you could rotate your hand for me. Obviously the palm is paler, so I am noting an undertone of pink here, which is a good indication of adequate blood flow, and some blue-green as we come down towards the wrist. Okay, that's very good. All right. So you said you're not currently having any pain or discomfort, no tingling, no pins and needle sensation, and you can feel everything adequately. There's no lack of sensation, no numbness anywhere. Okay. All right. If you could just tell me here if this here and this here feels about the same. Okay. And no change down the arm compared to the hand.
No.
Good. Okay. All right. So I would say we are okay to proceed with testing, and I am going to be using this arm, so you can do with that arm what is more comfortable for you. So you're welcome to relax it as necessary. Now, I'm going to go ahead and test for temperature abnormality. So this is just a standard thermometer gun. So just to show you, it's just going to measure regular body temperature. So just for documentation purposes, I am going to test the various areas and gather an average. and we will retest afterwards. And it just helps us see if there are any signs of internal inflammation. So obviously warmer up towards the fingers. Then I'll have you rotate your hand for me. So for an average reading of about 97.2, I'm getting a slightly lower point here. Okay, very good. All right. Okay, so we are going to go ahead and proceed with the testing part of the examination now. So to begin, I am going to put on a pair of gloves. Just going to make my tools slightly more accessible here. We're going to begin by cleansing the area, obviously, to keep it from potentially contaminating any of the samples that we apply. So okay, so this is just a ChlorPrep cleansing solution. It's going to thoroughly clean the area. So I'm going to have you come just a little bit closer to the table. You can let me know if that's uncomfortable. And starting at the elbow, I'm going to do sweeping motion. And this is just our first step cleanser. I'm going to leave that on for about 5 to 10 seconds. And lastly, we have our second step cleanser. It's a 2-part solution, so I'm just going to spray this directly on your arm. It is a little bit cold, so my apologies there. going to let that air dry for just a minute. All right, so it looks like our cleansing solutions have dried. Now they are going to leave just a slight tacky layer on the skin, which is completely normal. So I am going to go ahead and create our grid. Just going to approximate the length of your arm. Okay, so this is going to go directly along the center, down. Okay. These little sticky tabs are quite tedious to place, but it just makes it easier for us to match the samples to the testing area. I am going to just use this tool to adhere these slightly better to the skin. Okay, so the last thing I'm going to do before we actually apply the allergens is just use this to blow away any debris. So I just want to make sure that the testing area is free of any dust or any dead skin cells that we could have missed with the cleanser. All right, Samantha, if you are ready, we can go ahead and proceed with testing. Okay, so obviously right now there are no areas that appear red or any pinkening of the skin. There are no areas of inflammation. Once we apply the allergens, we might start to see some reactivity. So of course, just let me know if it becomes uncomfortable. Ideally, there would be no reaction, which would indicate that you don't have any allergies. So I guess we will be finding out together. Okay, so I'm just going to bring out the allergens. Don't want to alarm you. I realize this looks pretty significant. So there are 24 samples that we will be testing, and I am just going to go in order. So of course they are labeled appropriately. So it's just as simple as that. We apply the allergen, hold it for about 2 seconds, and then discard of the swabbing stick. process can be just a little tedious.
It's okay. In the name of science.
Mm-hmm. We're about a fourth of the way through. All right, we are on our very last sample. Thank you for your patience. I realize this is quite the lengthy process. Okay, so let me just set these aside. Thank you. Okay, so let's have a look just at our initial application here. So obviously we can see the little yellow spots where the dye is. So I'm just going to do a quick visualization and make sure that we got full saturation for each sample, which I am notating. Adequate deposit of color here. Okay, so all of the samples appear to be well saturated. The two here closest to your wrist are the controls, so we should not see a reaction on either one of these. If we do, then it indicates that something is wrong with the test itself. So all of that looks very good. Now, at this point, what I am going to do is have you just relax for me. We're going to leave the samples on for about 25 minutes. I will come back in. You'll hear a little alarm go off. You'll hear me enter the room, and then obviously we'll reassess. I'm going to leave you with a call bell. If you start to feel itchy, definitely any tingling of the mouth, nose, or throat, definitely hit the button and let me know so that I can come in. Okay? All right. Okay, so I will leave you be. You are welcome to watch TV or just keep yourself occupied, and I'll be back in about 25 minutes.
Sounds good.
Okay. All right, Samantha. So it's been about 30 minutes. I apologize for the delay. I was running a little bit behind, but you didn't hit your call bell, so I assume there were no adverse reactions. Okay, so I'm going to do a secondary visual inspection. I'm not noting anything just immediately. Nothing looks raised or elevated to me. I will do a closer inspection though, of course. Are you experiencing any symptoms, any itchiness of the throat or nose, any swelling?
Nothing like that.
No irritation or anything. Okay. So we're going to start with our control, of course. Looks like we have just a hair here. Okay. So control 2 is negative, and control 1 has absorbed and is negative. So I still see the yellowing of control 2, control 1 not so much, but certainly no swelling or elevation there. So I'm just going to turn skin here slightly. Now, I didn't give you too much information about the panel or the grid just because sometimes if we put the idea in your mind, it can kind of affect your body's reaction. So essentially the left side of the panel is our environmental allergies, mold, dust, dander, that kind of thing, pollen, as well as cats, dogs. Not seeing any reaction here at all. Now the first half of our right side of the panel is common food allergens, so we have gluten, lactose, eggs, shellfish, that kind of thing. So also not seeing any reactivity of the skin here. And then our last 4 of the panel before control 1 are the actual samples of the vaccination. So, okay, so our very first sample for the vaccination, don't notice any irritation there. Second sample, same thing. I do notice more yellowing here. So it does appear as if in some areas your skin has absorbed the sample, which is okay. So as we can see here, there's quite noticeable coloring. Okay. That is very good. So I'm also just going to look from this angle and make sure I'm not missing any elevation of the surface of the skin. Certainly no signs of swelling. Okay. All right. So let's go ahead and remove the adhesive so that I can visualize the skin itself. I do apologize. These are just a little sticky. Now, before I remove the tape, I'm just gonna just makes it a little bit easier on the skin. All right, now let's have a final look here. So obviously we can see the areas that are clean versus the areas that are sampled. In our sampled areas, I don't notice any irritation. Truthfully, the pinker areas are where the tape was, so you might actually have a slight allergy to adhesive. But none of the other areas appear to be irritated. Don't notice any bumps or elevated surfaces. Okay. Do note some pinkening here, but again, I think that is more so related to the tape. Okay, all right. Let me just we're about 2.5 inches from our elbow, and we're about 1 inch wide. So I'm just going to document here a slight reaction to the adhesive from the tape, and rule out any other signs of irritation which are not notable. And we had about 8 spots that fully absorbed the sample. right, so you can go ahead and relax your arm for now, Samantha. Let me just take a couple of notes here. So, a couple notable things. We are going to pull your file back up here. Okay, so we have completed the 24 grid sample, just a formality that I have to inform you. There were 0 indications of positive reaction. So good news is you're not allergic to anything that we tested you for. So I didn't even see that you were allergic to like the most common pollen or trees or plants that are in the area. Could just be that they're not super in season right now. They do sample seasonally. So right now, obviously we're moving towards fall. If they did a spring sample, it could come up that you were slightly allergic, but you should be okay for this time of year. No allergens to common foods, eggs, shellfish, that kind of thing, which obviously if you're already eating it, you would likely know. And most importantly, our vaccination samples were all completely negative. So that is a very good sign that we can move forward with phase 2 of trial testing, which would be actual injection of the samples. Okay. Now I am going to notate that you did have a reaction to the tape itself. Just a quick note for future reference, that way we can use a different type of marker. We have skin safe markers where we can actually draw on the skin instead of using tape, just so that we don't get any negative reaction there from that adhesive. So that is okay. And there were 8 areas that did completely absorb the sample, which is nothing significant to you really. It's just part of our documentation protocol. So we had, let's see, 16 samples that were not absorbed. Okay. And the irritation area was medial to the inner elbow, about 2.5 by 1 inch area. Notable pinkening. No signs of elevation. All right. Okay. All right, Samantha. Well, that is going to conclude phase 1 of the trial. Now, I will go ahead and submit all of this over to the team who does the check. They could basically go and look at the notes, as well as look at the sample testing and see if you are compatible for trial number 2. Now, I will put my recommendation in that we can move forward, and you should be reached out to by one of the best methods of contact that you provided. So either by phone or by email. They'll let you know when, if and when to come in for phase 2, and then we will proceed from there.
Sounds good.
Okay.
Thank you.
All right. Well, thank you very much. Just a quick heads up, if you are selected to come in for phase 2, they do require that you come in fasted. So for today's trial, you were able to eat prior to. For phase 2, we ask that you remain fasted for at least 12 hours.
Okay.
Okay? All right. So I will go ahead and get this submitted over, and we will be contacting you to move forward. Okay? Thank you very much. Get home safely.